How can a handler accurately interpret a dog's body language and vocalization to prevent aggression during a training session? Provide examples of specific body signals and vocal cues that suggest fear or aggression. What guidelines should a handler follow to ensure safe interaction with a dog displaying these signs? Answer: interpreting animal body language and vocalizations is critical in understanding their emotions and preventing aggression. In dogs, body signals such as raised hackles, stiff body posture, growling, and direct staring are often indicative of fear or aggression. Vocal cues like growling or barking can also signal discomfort or a warning. Examples of signs of fear or aggression in dogs: raised hackles, a sign of anxiety or defensiveness, not always linked to aggression but should be noted. Baring teeth, a direct sign of aggression, usually accompanying growling, a vocalization warning the handler to back off. Tail position, a stiff or high tail can indicate alertness or aggression, while a tucked tail signals fear. To safely interact with an aggressive dog, a handler should recognize signs early and avoid escalating the situation. Provide space, avoid making direct eye contact, which may be perceived as a challenge. Use calm, positive reinforcement to encourage desirable behavior. Follow ethical guidelines such as the 5 freedoms of animal welfare: freedom from hunger and thirst, freedom from discomfort, freedom from pain, injury, or disease, freedom to express normal behavior, freedom from fear and distress, to guide interactions. What are the key principles of infection control in an animal care setting, and how can proper sterilization practices prevent the spread of pathogens? Explain the role of personal hygiene in maintaining a biosecure environment. Answer: infection control principles focus on minimizing pathogen spread to protect both animals and humans. Key practices include sterilization, isolation, and hygiene protocols. Sterilization and disinfection. Proper sterilization of equipment and spaces prevents pathogen transmission. Surfaces should be disinfected with appropriate chemicals, such as sodium hypochlorite or alcohol-based solutions, to kill bacteria and viruses. Hand hygiene. Routine hand washing is essential before and after handling animals. Soap and water should be used for at least 20 seconds to remove contaminants. Additionally, gloves should be worn when handling animals, especially those suspected to be ill, to avoid cross-contamination. Isolation protocols. New or sick animals should be quarantined from healthy animals to prevent disease transmission. Symptoms should be closely monitored, and all quarantine procedures should be strictly followed as per the biosecurity guidelines. Biosecurity measures, ensuring limited access to animal care facilities by unauthorized personnel and implementing protocols for cleaning and disinfecting tools and surfaces reduces the risk of pathogen spread. Facilities must have clear access control and decontamination stations. Mr. Thompson, an animal care worker at a shelter, has just introduced a new cat into a communal room with other resident cats. The new cat begins hissing, arching its back, and showing signs of aggression toward the other cats. How should Mr. Thompson proceed to minimize the risk of injury and improve the situation? What behavior management strategies should he use? Answer: Mr. Thompson should immediately separate the aggressive cat from the other residents to avoid potential injury. Aggression in cats is often territorial, and sudden introductions can provoke defensive behaviors. Steps to take: create a safe space. Isolate the aggressive cat in a separate room or enclosure for a short period, allowing it to acclimatize to its new environment without the stress of other animals. Gradual introduction. Reintroduce the cat to the others slowly. Start with scent swapping. Place the aggressive cats bedding near the other's space, allowing them to become accustomed to each other's scent before a face-to-face introduction. Use positive reinforcement. Reward both the aggressive cat and the other cats for calm behavior during the introduction process. Monitor body language. Mr. Thompson should observe subtle signs of stress or aggression, such as dilated pupils or tail lashing, and intervene early if aggression escalates. Consider veterinary consultation. If the aggression persists, consulting a veterinarian for possible underlying health issues such as pain or hormonal imbalances should be considered. What are zoonotic diseases, and why is it important for animal care professionals to be aware of them? Provide 3 examples of zoonotic diseases that can transfer from animals to humans, along with their transmission routes and preventive measures. Answer: zoonotic diseases are infections that can be transmitted between animals and humans, and animal care professionals must be vigilant in recognizing these diseases to prevent potential outbreaks in care settings. Awareness ensures both animal and human safety. Examples of zoonotic diseases: rabies, a viral disease affecting the nervous system, primarily transmitted through bites from infected animals. It is fatal if not treated promptly. Preventive measures include vaccination of animals and avoiding contact with wild animals. Salmonella bacteria commonly found in reptiles and poultry. Humans can become infected through direct contact with animals or contaminated food. Prevention includes hand washing after handling animals and using personal protective equipment, PPE, such as gloves when handling feces or raw food. Leptospirosis, caused by bacteria found in the urine of infected animals, particularly rodents. It can be transmitted through contact with contaminated water or soil. Preventive measures include wearing protective clothing when cleaning animal enclosures and avoiding water sources that may be contaminated. How can animal care workers effectively use positive reinforcement to encourage desirable behaviors in animals, particularly in a shelter setting? What are the potential challenges of using this method, and how can these challenges be overcome? Answer: positive reinforcement involves rewarding desirable behaviors to increase their frequency. This can be particularly effective in shelter settings to help animals adjust to new environments or learn basic commands. Steps to implement positive reinforcement: timing and consistency. Reinforcements must be delivered immediately after the desired behavior to strengthen the connection between action and reward. Consistency is key to maintaining the behavior. Appropriate rewards. Use rewards that are motivating for the animal, such as food, treats, praise, or toys. The reward should match the animal's preferences and the level of difficulty of the behavior. Gradual shaping. Start by reinforcing small steps that lead to the desired behavior. For example, if training a dog to sit, begin by rewarding it for simply lowering its rear end toward the ground. Challenges: overuse of food rewards. If food is used too frequently, the animal may become overly focused on the reward, leading to potential weight gain or dependency. To overcome this, varying the type of reinforcement, e.g., praise or toys, can maintain the effectiveness of the method. Distractions in a shelter environment. External stimuli, e.g., other animals, noise can hinder the effectiveness of training. Ensuring a quiet, distraction-free space for training can help improve focus. Why is it essential to understand the social behaviors of different animal species in a care setting? How do social behaviors impact the management of animals in groups, and what are the risks of not considering these behaviors? Answer: understanding social behaviors is crucial because each species has different needs and hierarchies that can influence their interaction with other animals and humans. Managing animals in groups without considering these behaviors can lead to stress, aggression, and even injury. Species-specific behaviors. For example, dogs are generally pack animals and often benefit from group environments where they have clear social hierarchies, while cats are more solitary and may become stressed in groups. Understanding these preferences can help in designing appropriate living spaces. A risk of ignoring social needs. If social behaviors are ignored, animals may become stressed, leading to health issues, aggression, or poor welfare. For example, horses are highly social and benefit from companionship, while rabbits may become territorial. To ensure animal welfare, it's important to observe how animals interact and make changes as needed. E.g., separate aggressive individuals. Provide enrichment that encourages natural social behaviors such as safe play or quiet spaces for solitary animals. What are the essential steps involved in setting up a quarantine protocol for newly admitted animals? How can these procedures help prevent the spread of infectious diseases within a facility? Answer: quarantine is crucial to prevent the spread of contagious diseases within a facility. It involves isolating new or sick animals from healthy ones until their health status is confirmed. Steps for quarantine procedures: separate housing. Ensure that quarantined animals are housed away from the main population. The area should be equipped with its own feeding, water, and sanitation facilities to minimize the risk of cross-contamination. Health monitoring. Regular health checks, including temperature monitoring, observation for symptoms, e.g., coughing, diarrhea, and tests for common infections, should be carried out. Sanitation. Use separate equipment for quarantined animals and disinfect all tools and surfaces thoroughly before reusing them for healthy animals. Limit staff access. Restrict staff access to quarantine areas to reduce the risk of transmission, ensuring that staff members change PPE and wash hands before and after interacting with quarantined animals. What specific precautions should animal care workers take when handling infected animals, and what are the disposal and decontamination protocols for infected materials? Answer: handling infected animals requires strict adherence to personal protective equipment, PPE, guidelines, and decontamination protocols to prevent the spread of infectious agents. PPE use. Workers must wear gloves, masks, gowns, and face shields when handling infected animals to minimize exposure to zoonotic diseases. Isolate and contain. Infected animals should be isolated in well-ventilated, separate areas with their own equipment. Disposal protocols. Materials such as bedding, food, and waste from infected animals should be disposed of in biohazard bags and treated before disposal according to local regulations. Decontamination. Equipment used to handle infected animals must be sterilized using appropriate disinfectants. High-touch surfaces should be wiped down thoroughly, and all PPE should be removed carefully to avoid cross-contamination. What are the most common infection control measures taken in animal shelters to ensure a safe environment for both animals and staff? Discuss the importance of regular facility disinfection and the role of staff hygiene. Answer. Common infection control measures in animal shelters include routine disinfection. All surfaces, cages, and equipment should be cleaned regularly with effective disinfectants to kill pathogens. Hand hygiene. Staff should wash hands thoroughly between animal interactions, especially when handling animals with suspected infections. Air quality management. Ensuring proper ventilation and air filtration systems to prevent airborne pathogens from circulating. Use of PPE. Staff should wear gloves, masks, and gowns as needed to prevent direct contact with infected animals. What are the key animal welfare laws and ethical considerations that animal care professionals must be aware of when managing animals in a shelter or care facility? How do these laws impact decision-making and daily operations? Answer. Animal welfare legislation ensures that animals are treated humanely with consideration for their physical and emotional well-being. Key laws and ethical considerations include Animal Welfare Act. This law sets the minimum standards for the care and treatment of animals in shelters, including provisions for adequate food, water, shelter, and veterinary care. Animal care workers must ensure that these basic needs are met. 5 freedoms of animal welfare. This ethical framework includes the right to freedom from hunger and thirst, discomfort, pain, injury, and disease, freedom to express normal behavior, and freedom from fear and distress. These principles should guide all decisions and daily operations in animal care settings. Humane euthanasia guidelines. Animal care workers must adhere to local or national guidelines regarding humane euthanasia for animals that are severely ill or unadoptable, ensuring that the procedure is performed in a way that minimizes pain and distress. These laws and ethical guidelines affect decision-making by ensuring that decisions about animal care, euthanasia, adoption, and rehabilitation prioritize the animal's well-being and meet legal standards. What is the significance of hazard identification and risk assessment in the animal care industry, and how should it be implemented to ensure a safe workplace? Answer. Hazard identification and risk assessment are essential components of ensuring workplace safety in the animal care industry. The process involves identifying potential hazards such as animal bites, zoonotic diseases, slips and falls, and exposure to hazardous chemicals. Once hazards are identified, a risk assessment is conducted to determine the likelihood and severity of these risks occurring. This helps prioritize actions that reduce or eliminate the risk. To implement hazard identification and risk assessment effectively, animal care facilities should conduct regular risk assessments to identify new and existing hazards. Assess the risk level by considering the probability of incidents and their potential consequences. Develop mitigation strategies such as training staff on proper animal handling and implementing safety protocols, e.g. protective barriers, PPE. Review and update risk assessments regularly, ensuring they reflect changes in procedures or the introduction of new hazards, e.g. new animals or chemicals. A worker in an animal care facility has been exposed to a chemical disinfectant and is experiencing symptoms of dizziness and irritation. What immediate actions should be taken according to workplace safety protocols? Answer. In the event of exposure to a hazardous chemical such as a disinfectant, the following immediate actions should be taken. Move the worker to a safe area away from the chemical exposure. Provide first aid, which may include flushing the affected area with water if skin contact or moving the worker to fresh air if inhalation. Document the exposure. The worker should report the incident to a supervisor, and a formal incident report should be filed according to facility protocols. Seek medical attention. If symptoms persist or are severe, such as dizziness or difficulty breathing, medical professionals should assess the worker immediately. Relevant guideline circulations. Safety data sheets (SDS) for chemicals provide essential first aid information specific to each substance. Occupational health and safety (OS) regulations require employers to have an incident response plan in place, including first aid and emergency procedures for chemical exposure. Mr. Johnson, a new employee at an animal care facility, is unsure about the proper handling of hazardous cleaning chemicals. He needs to clean the enclosures for several animals, but the chemicals provided have unclear labeling. What should Mr. Johnson do in this situation? Answer. Mr. Johnson should take the following steps. Do not use the chemicals until further clarification. Using unclear or improperly labeled chemicals can be dangerous. It's critical to avoid any potential accidents, such as exposure to toxic fumes or burns. Seek guidance from a supervisor. Mr. Johnson should immediately report the issue to his supervisor, who can provide the correct procedure or supply safer, properly labeled alternatives. Consult the Safety Data Sheets (SDS). If available, Mr. Johnson should request the SDS for the chemicals to understand the proper usage, safety precautions, and first aid measures. Follow the facility's chemical safety protocol. This may include wearing appropriate PPE and ensuring proper ventilation while using cleaning chemicals. Relevant guidelines, regulations. Workplace health and safety regulations require that chemicals used in the workplace be clearly labeled and that employees have access to SDS. OSHA's Hazard Communication Standard (HCS) mandates that employers provide information and training about hazardous chemicals, including how to handle them safely. Why is the proper use of personal protective equipment (PPE) important when handling animals, and what are some examples of PPE used in an animal care environment? Answer: the proper use of personal protective equipment (PPE) is crucial in preventing injuries and exposure to zoonotic diseases, allergens, and other potential hazards in the animal care environment. PPE acts as a barrier between the worker and potential risks, such as bites, scratches, chemical exposure, and airborne pathogens. Examples of PPE in animal care include gloves to protect hands from bites, scratches, and contact with hazardous chemicals, masks and respirators to prevent inhalation of harmful fumes or airborne pathogens, e.g. dust from bedding or chemical vapors, safety goggles to protect eyes from splashes of chemicals or foreign objects, protective footwear to protect against bites or heavy equipment accidents, especially in environments where large animals are handled. Relevant guidelines, regulations. OSHA's Personal Protective Equipment Standards 29 CFR 1910 Subpart I outline employer requirements for providing and ensuring the proper use of PPE. Workplace Health and Safety Acts in many jurisdictions mandate that employers provide appropriate PPE for all workers based on the risks associated with their tasks. What are the main responsibilities of an animal care worker regarding the safe operation and storage of equipment in a facility? Answer: animal care workers have a duty to ensure that equipment is used safely and stored correctly to prevent accidents and maintain a functional working environment. Their main responsibilities include following proper operating procedures for all equipment, ensuring that safety guidelines are understood and adhered to, inspecting equipment regularly for signs of wear and tear or malfunction, such as cracks in cages, faulty electrical wiring in heaters, or damage to grooming tools. Proper storage of equipment, including chemicals, tools, and machinery to prevent misuse and avoid accidents. For example, cleaning chemicals should be stored in labeled containers away from food or animal areas. Reporting faulty equipment immediately to supervisors, ensuring it is repaired or replaced to prevent injury or damage. Relevant guidelines, regulations. OSHA's Equipment Safety Standards, Animal Welfare Act, and local regulations. Explain the role of incident reporting in animal care and why accurate documentation is important for workplace safety. Answer: incident reporting is a critical component of workplace safety in the animal care industry. When accidents, injuries, or safety hazards occur, it's essential to document the event thoroughly to ensure proper follow-up and prevention measures. The role of incident reporting includes identifying hazards. By documenting incidents, the facility can identify recurring problems or gaps in safety protocols. Legal protection. Accurate reports protect both employees and employers in the case of legal claims or workers' compensation issues. Preventative measures. Reports are used to analyze the incident, which helps in modifying procedures, improving training, and preventing similar occurrences in the future. Relevant guidelines, regulations. Occupational Health and Safety Act (OHS) requires employers to have an incident reporting system in place, and workers must report injuries or unsafe conditions. Workers' compensation legislation mandates that incidents be documented to ensure fair claims processing and injury management. How should an animal care worker respond to an animal bite, and what specific first aid steps should be taken? Answer: an animal bite can be a serious injury, and proper first aid must be administered immediately. Clean the wound. Wash the bite area thoroughly with soap and water to reduce the risk of infection. Stop the bleeding. Apply gentle pressure with a clean cloth to control bleeding. Disinfect. Apply an antiseptic to the wound to prevent infection. Seek medical attention. If the bite is deep, painful, or the animal is unknown or exhibits signs of rabies, the victim should seek medical care immediately for a tetanus shot or rabies post-exposure treatment. Report the incident. The worker should notify the supervisor and document the incident according to workplace protocols. Relevant guidelines, regulations, workplace health and safety regulations require employers to ensure that first aid protocols are in place for common injuries like bites. The Animal Welfare Act emphasizes humane treatment of animals, including preventing situations that may lead to injury. What are the main safety considerations when working with hazardous chemicals in an animal care facility? Answer: when working with hazardous chemicals, such as disinfectants or medications, the following safety considerations should be observed. Proper labeling and storage. Ensure chemicals are clearly labeled with hazard symbols and stored in a cool, dry place away from direct sunlight or incompatible materials. Use of appropriate PPE. Gloves, goggles, and respirators should be worn when handling chemicals to avoid skin and eye contact or inhalation. Proper ventilation. Work areas where chemicals are used should be well ventilated to prevent the buildup of harmful fumes. Training. Workers should be trained on the proper handling of chemicals, including understanding safety data sheets, SDS, and emergency procedures. Relevant guidelines, regulations. Hazard Communication Standard ATS OSHA requires that employers ensure the proper labeling, storage, and handling of hazardous chemicals. Workplace health and safety regulations require safe handling and disposal of chemicals to protect workers and the environment. Mrs. Harrison is cleaning the animal enclosures with a new chemical disinfectant. She notices that the chemical has a strong smell and begins to feel lightheaded. What should she do immediately? Answer: Mrs. Harrison should stop using the chemical immediately and move to a well-ventilated area to get fresh air. Alert a supervisor about the situation, providing details of the chemical used and her symptoms. Consult the safety data sheet, SDS, to understand the chemical's risks and recommended first aid measures. Seek medical attention if symptoms persist, especially if she experiences difficulty breathing, dizziness, or nausea. Relevant guidelines, regulations. OSHA's Hazard Communication Standard, ATS, requires employers to train employees in recognizing hazardous chemicals and taking immediate actions to protect themselves in case of exposure. Workplace Health and Safety Acts require employers to provide proper ventilation and PPE when using chemical substances in confined spaces. What are the best practices for ensuring animal care workers are adequately trained in workplace safety protocols? Answer: best practices for ensuring proper training of animal care workers in workplace safety protocols include regular safety training sessions, hold annual or semi-annual safety workshops covering topics like hazard identification, PPE use and incident reporting, hands-on training, provide practical demonstrations on the safe handling of animals, equipment, and chemicals, clear documentation, maintain a safety manual or guide for employees detailing procedures for common tasks and emergency protocols. Ongoing assessments. Evaluate workers' understanding of safety protocols through quizzes, hands-on assessments, or real-world simulations of emergencies. Relevant guidelines, regulations. OSHA training requirements. Employers are required to train workers on workplace safety, including animal handling, equipment use, and chemical safety. Workplace Health and Safety Acts mandate regular training and competency assessments to ensure the safety of all workers. Why is it critical to minimize stress and discomfort when handling animals, and how can an animal care worker achieve this in practice? Answer: minimizing stress and discomfort during animal handling is vital for the animal's welfare and for the safety of both the animal and the handler. The 5 freedoms, which include freedom from hunger, thirst, discomfort, pain, injury, disease, fear, distress, and the freedom to express normal behavior, are fundamental to understanding humane handling practices. To achieve this, animal care workers must observe the animal's behavior before handling, assess the animal's body language, e.g. relaxed posture or signs of fear, aggression such as flattened ears or growling, use appropriate equipment. For instance, a leash for a dog, a catch pole for a large, frightened animal, or a safe restraint method for exotic species. Provide a calm environment. Speak softly, avoid sudden movements, and maintain a steady approach to prevent the animal from feeling threatened. Humane handling is also grounded in ethical considerations such as minimizing fear and avoiding unnecessary pain. Failure to minimize stress can lead to injury or escalation in aggression, which may harm the animal or handler. What are the key factors to consider when selecting restraint techniques for a dog versus a bird? Answer: when selecting restraint techniques for animals, the species' physical characteristics, behavior, and stress response must be considered. Restraint methods should be adapted to avoid causing distress or injury. Dogs. Restraint for dogs should focus on control in their movement to ensure the safety of both the dog and the handler. Techniques like the standing method or sitting method are common, where the handler uses a leash to control the dog's position. For aggressive or nervous dogs, the use of a muzzle or additional handlers may be necessary. Birds, especially small ones, are more fragile, so restraint should be light yet firm to prevent flight or injury. A common technique is the towel method, where the bird is gently wrapped in a towel, leaving its head exposed. Restraint should be minimal to avoid stress-induced trauma, especially to their wings. In both cases, the handler should assess the animal's behavioral state to determine the appropriate level of restraint, ensuring that it doesn't escalate into aggression or excessive fear. Mr. Thompson is working at a veterinary clinic and has been asked to restrain a cat for a routine checkup. The cat seems particularly agitated, with wide eyes, flattened ears, and growling. What steps should Mr. Thompson take to safely restrain the cat and ensure its welfare? Answer: in this situation, Mr. Thompson should take the following steps. Assess the cat's behavior. The cat's wide eyes, flattened ears, and growling indicate signs of stress and fear. This is a defensive behavior, and restraint should be done with caution. Minimize stress. The clinic environment should be calm and quiet to avoid further stress. Mr. Thompson should avoid sudden movements or loud noises, use appropriate restraint tools. Since the cat is showing signs of aggression, Mr. Thompson should use a soft, non-restrictive restraint method, such as gently wrapping the cat in a towel, leaving its head exposed. This will prevent injury to the cat while still allowing the vet to perform the checkup, monitor the cat's stress levels. Mr. Thompson should observe any changes in behavior and be prepared to stop or modify restraint if the cat becomes too distressed. Ensure the safety of both the animal and the handler. Mr. Thompson should also remain mindful of his own safety, as an agitated cat can scratch or bite. This scenario illustrates the importance of using humane handling techniques, recognizing signs of distress, and selecting the appropriate restraint tools. What are the ethical and legal responsibilities of an animal care worker when they suspect an animal is being abused or neglected? Answer: an animal care worker has both ethical and legal responsibilities when they suspect abuse or neglect. These responsibilities are rooted in animal welfare laws, such as the Animal Welfare Act in many jurisdictions, and are intended to protect the rights and well-being of animals. Ethical responsibility: animal care workers are ethically obligated to ensure that animals under their care are treated humanely and with dignity. This includes identifying signs of neglect, e.g., malnutrition, injuries, and abuse, e.g., fear-based behaviors or physical harm, and taking steps to report them. Legal responsibility: legally, animal care workers are required to report suspected abuse or neglect to the appropriate authorities, such as local animal control or law enforcement. In many regions, there are laws protecting whistleblowers who report abuse in good faith. Failing to report can lead to criminal charges, as workers are responsible for the welfare of the animals in their care. Under the Animal Welfare Act, failing to act on suspected neglect or abuse can lead to legal penalties, including fines or imprisonment. The legal framework ensures that animals are protected and that those who are responsible for their care uphold high standards of ethical treatment. How can animal care workers recognize signs of distress in animals, and what actions should they take when these signs are observed? Answer: recognizing signs of distress in animals is essential for ensuring their welfare and preventing harm. Some common signs of distress include panting or excessive salivation, often a sign of fear or anxiety in dogs; flattened ears or growling, common in fearful or aggressive animals; restlessness or pacing, often observed in animals that are stressed or in pain; limping or vocalizations may indicate pain or injury. When these signs are observed, the animal care worker should stop the handling. If possible, cease any actions that might be causing distress and allow the animal time to calm down. Just restraint methods: use less invasive methods of restraint or allow the animal some freedom to regain composure, especially if the animal is visibly distressed. Monitor and assess. Continuous monitoring of the animal's behavior is necessary to ensure the situation doesn't escalate. Consult with a veterinarian. If the distress is severe or involves signs of injury, it is important to get professional help. What is the role of behavioral assessment prior to handling, and how does it contribute to safer animal care? Answer: behavioral assessment prior to handling is crucial for understanding an animal's emotional state and determining the safest approach to care. By assessing body language and vocalizations, animal care workers can gauge the animal's comfort level and identify potential risks of aggression or stress. Key components of a behavioral assessment include observing body language. Signs such as relaxed posture or wagging tails indicate calmness, while tense muscles, bared teeth, or hissing indicate fear or aggression. Assessing vocalizations. Growling, hissing, or barking may indicate discomfort or fear, whereas meowing or whimpering can be a sign of submission or distress. Prior experience with the animal. If the animal has been handled previously, its history of behavior should be reviewed to identify patterns that may help predict its response to certain handling methods. By assessing behavior before restraint, the worker can minimize the risk of harm to both the animal and the handler, ensuring that humane methods are applied in accordance with ethical standards like the 5 freedoms. Describe the differences between using a leash and a catch pole for animal restraint and when each should be used. Answer: a leash and catch pole are both tools used for animal restraint, but they differ in their application and the circumstances in which they are appropriate. A leash is typically used for animals that are not aggressive and can be controlled with gentle guidance. It is suitable for dogs and some small animals. The leash provides control over the animal's movement, but does not restrict the animal's ability to breathe or move its limbs. Catch pole. A catch pole is a tool used for restraining more aggressive or panicked animals, particularly large dogs or animals in distress. The catch pole has a loop at one end that can be placed around the animal's neck. It allows the handler to safely control the animal from a distance without getting too close, reducing the risk of injury. However, the use of a catch pole should be done with caution to avoid causing additional stress or injury. The key difference is that the leash is appropriate for animals that are more manageable and cooperative, while the catch pole is used in more challenging situations with animals exhibiting aggressive or fearful behaviors. What role do ethical concerns play in the handling and restraint of animals, and how can animal care workers ensure they follow ethical practices? Answer: ethical concerns in animal handling and restraint are primarily centered on the 5 freedoms of animal welfare and ensuring that animals are treated with respect and care. Ethical handling means minimizing distress and harm while ensuring that the animal's needs are met. Workers must avoid practices that cause unnecessary pain or fear, as these go against the principles of humane treatment. To ensure ethical practices, follow established protocols, always use the least invasive method of restraint and handling to achieve the goal, respect the animal's welfare, be attentive to signs of distress and stop or adjust methods if needed. Continuous education. Animal care workers should stay informed about the latest best practices and ethical guidelines through training and awareness of animal welfare laws. By adhering to ethical standards, animal care workers fulfill their duty to safeguard the welfare of the animals in their care while maintaining compliance with legal and professional expectations. What are the potential consequences of non-compliance with animal welfare laws in an animal care setting? Answer: non-compliance with animal welfare laws can have serious consequences for both the animals in question and the individuals involved in their care. Some potential consequences include legal penalties. This may include fines, suspension of the business license, or criminal charges under animal protection laws like the Animal Welfare Act. Loss of reputation. An organization or individual found in violation of animal welfare laws can suffer significant reputational damage, leading to a loss of clients and trust in the community. Harm to animals. Non-compliance can lead to the continued mistreatment of animals, resulting in physical or emotional harm. Employment consequences. Animal care workers who fail to comply with laws may face disciplinary action, including termination, lawsuits, or even criminal prosecution. Complying with animal welfare laws ensures the protection of both animals and professionals, fostering a safe and humane environment. What are the main ethical concerns in captivity, and how do they relate to animal handling and care? Answer: the main ethical concerns in captivity are centered on the 5 freedoms and ensuring that animals do not suffer unnecessarily due to confinement. Key issues include space and environmental enrichment. Animals in captivity often have limited space, which can lead to psychological distress. Ensuring that they have access to adequate space, exercise, and environmental enrichment can mitigate this. Social interaction. Many animals, particularly social species, need interactions with others of their kind. Captivity can cause loneliness and stress for animals that thrive in social groups. Proper care and handling. Ethical animal handling involves using humane methods to interact with animals, minimizing stress, pain, and fear. Animal care workers must uphold ethical standards by ensuring that captivity does not compromise an animal's well-being, following animal welfare laws, and advocating for the ethical treatment of all animals.